Quite often it will be the responsibility of the assistant or technician to monitor the patient during the procedure. Good monitoring involves focusing your attention on primarily 3 areas: temperature, pulse, and respirations, often abbreviated TPR. Monitoring temperature becomes especially important with extended surgical procedures. Animals will often become hypothermic or cold during these procedures. Feeling the skin and ears or taking a rectal temperature will make you aware of these changes. Pulse is perhaps the most significant area you will need to monitor. Many types of monitors are available that will make heart monitoring much more accurate. ECGs, stethoscopes, and pulse oximeters are all common instruments that will alert you to changes in heart rate or related circulatory changes. An esophageal stethoscope works by placing a hollow sound tube down the esophagus in the vicinity of the heart. From here, you can easily monitor the heart. A standard stethoscope can also be used on the patient's chest, but be careful not to disrupt the sterile field. The pulse oximeter is especially useful because it monitors both heart rate and blood oxygen levels. The color of the gums or mucous membranes is also a good indicator of adequate circulation. The patient's gums should maintain a pink color, and this color should quickly return when the gums are pressed on with your fingertip. This evaluation is called the capillary refill time. It will generally take less than 1 second to regain their normal pink color. Monitoring respirations involves making sure the patient is taking regular breaths. This can be done by watching the movement of the chest or observing the rebreathing bag on the anesthetic machine. More will be discussed on monitoring techniques and instruments in upcoming programs. Some surgery patients will need to receive fluid therapy during the surgical procedure. Fluids help to support the circulation and serve to replace fluid loss associated with blood loss. The fluid administration rate will be determined by the veterinarian. You should pay attention to the drip rate to assure proper fluid levels are being administered. Fluid pumps regulate this drip rate very accurately and can be programmed to alarm you if this rate is altered. In this next section, we will focus on surgical instruments and the proper care, cleaning, and packing of these instruments. There are hundreds of different instruments used by veterinary surgeons. For the purpose of this program, however, we will narrow our discussion down to the most commonly used instruments found in veterinary surgery packs. Your familiarity with the instrument names will be especially beneficial when assisting in surgery, and it becomes necessary to hand the surgeon a particular instrument. Let's begin with the scalpel. This cutting instrument consists of a disposable blade and a reusable handle. Various blade sizes and shapes are available. Shown here are 3 of the most commonly used blades with their corresponding numbers. The attachment and removal of these blades should always be done with needle holders by lifting the back of the blade. Never use your fingers, as this may result in a serious cut. The needle holder's primary function is to grasp the suture needle while suturing tissue. Note the box lock feature in the handle that maintains the instrument in a closed position. To release the instrument's grip, squeeze the 2 handles together while offsetting the locking mechanism. Notice how this particular pair of needle holders possesses a pair of scissors adjacent to the gripping surface. This allows the surgeon to cut the suture without having to pick up a pair of scissors. Scissors come in various styles and shapes. Operating scissors are described by whether the blade is straight or curved. They are also described by their tips, either sharp or blunt. This pair of Metzenbaum scissors has a curved blade and a blunt tip. They are used for cutting and separating delicate tissues. The heavier Mayo scissors shown here are used on tougher tissues. Forceps are generally instruments used to grasp and hold tissue. The thumb tissue forceps are simple to use with their spring action design. These Brown Adson forceps are equipped with additional teeth that allow them to stabilize the tissue without having to crush it. Another type of forceps are tissue forceps. The most common type of tissue forceps is probably the Alice tissue forceps. This instrument will hold tissue with a locked grip with moderate trauma to the tissue. Hemostatic forceps are designed to squeeze off blood vessels and control bleeding. For small blood vessels, mosquito hemostats are used. For larger blood vessels, Kelly and Kreil forceps are commonly used. Note how the teeth of these Kelly forceps extend only halfway down the instrument, whereas they extend down the full length of the Kreil forceps shown here. Carmalt forceps have grooves that run parallel with the instrument. These grooves are designed to grip and crush. Towel forceps, as the name describes, have the purpose of grasping the towel or drape and securing it to the patient. Retractors are instruments designed to hold back tissues. The retractor properly used allows the surgeon to visualize more readily the tissues they are attempting to work with. A common variation of the retractor is the Snook ovariohysterectomy hook. This instrument helps the veterinarian gain control of the uterus when performing an ovariohysterectomy or SPAY. The instruments just discussed are some of the most commonly encountered instruments in the veterinary surgery pack. You should familiarize yourself with others that are present in your doctor's packs. Most veterinary hospitals will have various surgery packs containing just the needed instruments for various types of surgeries. Your familiarity with surgical instruments will not only make you an asset to the veterinary surgeon as you assist in surgery and surgical preparations, but it will also make the job more interesting as you come to understand the way each instrument is used for its specific purpose. Once the surgery is complete and the sterile field has been broken, it is time to begin the cleanup process. Caring for these expensive instruments is a very important component in ensuring that the instruments last many years. Before blood has had time to dry on the instruments, they can be soaked in cold water to loosen the blood. They will then need to be scrubbed with an instrument brush or toothbrush to be sure they are 100% free of obvious blood and tissue. Next, the instruments are often allowed to soak in a solution called instrument milk for approximately 10 minutes. This non-oily lubricant provides the instruments with a protective barrier that helps retard corrosion. They are then allowed to air dry. If instrument milk is not used, they should be hand-dried. The packing of the instruments will vary greatly based on the preference of the surgeon. A few principles will be helpful when arranging the surgery packs. First, the instruments are loosely packed in such a way as no sharp pointed instrument will penetrate a wrap, especially paper wraps. Second, be sure that all accessory items are included. For example, drapes, gauze sponges, a sterile indicator, suture needles, scalpel blades, and hand towels are sometimes included into the surgical pack. And finally, be sure the surgery pack is either double wrapped or wrapped in such a way that it can be opened without breaking its sterility. Before repacking the surgery pack, make sure that all instruments are accounted for. This is often done by having a checklist or illustration showing all the instruments in that particular surgery pack. Every instrument is important and should be accounted for. Once the pack is wrapped, it is taped with sterile indicator tape. Masking tape may be substituted, but always have a short piece of indicator tape visibly present. The surgery pack is now ready to be sterilized in the autoclave. A basic understanding of suture materials will be helpful in your assisting the veterinary surgeon. The two types of suture material are those that are absorbable and those that are non-absorbable. Absorbable suture materials are those that will dissolve and completely disappear with time. Such materials are designed to be used within the body and will hold the tissues in place until the tissues have had sufficient time to mend themselves together. Most foreign materials, with the exception of stainless steel, will create irritating tissue reaction if left in the body too long. Some common examples of absorbable suture are catgut, Vicryl, and PDS. Non-absorbable suture remains strong and intact for extended periods of time, often years. Some examples of these are bronamide, nylon, and Prolene. They are generally used in the skin or in tissues that require their extended longevity. The suture materials are packaged in either individual sterile plastic wraps or in multi-use spools. The suture material on a spool will require the surgeon to first thread a needle before its use. The individual packs often contain the suture needle pre-attached. This is called a swedged-on needle. Though slightly more expensive, these swedged-on needles offer the advantage that they pass through the tissue with less resistance than a knot. There are various sizes and shapes of suture needles that can be used, but they are generally divided into two types, cutting and taper. The cutting needle possesses razor-sharp edges that allow it to pass through tougher tissues, such as skin, with greater ease. The taper needle has no cutting edges, and thus passes through delicate tissues with less tissue damage. Both of these needles will be used by the veterinary surgeon at various times depending on the tissue being sutured, and should be regularly replaced as needed. Special clips or gauze sponges are often used to contain these sharp needles within the surgery pack. In closing, a few comments should be made regarding the operating room. The room should be maintained to the highest standards of cleanliness. Most hospital-grade disinfectants and cleaners will very adequately disinfect the floors, tables, and other surfaces. A regular maintenance and cleaning schedule should be followed to help prevent surgical infections from occurring. Access to this room should also be limited to those on the surgical team. Other items that are located in most surgery suites are the surgical light to provide good illumination of the surgical site, a cautery unit used to electrically burn tissue and blood vessels in order to stop their bleeding, and a suction unit to suction away blood and other fluids so the surgeon can more easily see what they're doing. These and other instruments all work together in harmony with the surgeon and their skilled assisting team to provide the amazing miracle we call veterinary surgery. With the skills you've been oriented to thus far, you can begin the process of being a valuable addition to the surgery team.